You guys might have heard a lot about hair transplant. You must have watched so many videos about the different methods, different doctors, different clinics, and so many other things. So today we're going to be talking about FUE versus FUT hair transplant, the different techniques, what they are, which one is better for you, and what to expect. I'm Dr. Anika Goel, Chief Consultant Dermatologist and Hair Transplant Surgeon in GK1 New Delhi, and today we're going to be talking about hair transplant in South Delhi. The two main techniques of hair transplant that we talk about these days are FUE and FUT hair transplant. So what is FUE versus FUT hair transplant? FUE, also known as Follicular Unit Extraction, this is the newer method of hair transplant. It's even considered the gold standard. In FUE, we are basically taking follicular units or grafts from the donor area or the back of the scalp using a punch. We then transplant it to the recipient area. In FUT, also known as Follicular Unit Transplantation, this is a strip method in which a strip is taken from the back of the head, which is also a more invasive procedure. The strip is taken, sutures are also used. So in overall, this is considered a more invasive procedure than the FUE method, which is considered the more newer method. Now, we also hear about these advanced techniques like Bio FUE and various other permutations, combinations to give better results, maybe Nano FUE, Micro FUE, and so many other variations. What is Bio FUE? Bio FUE is simply the combination of PRP with the hair transplant to give you better results, better uptake of grafts, and better healing, which eventually leads in lesser downtime, which is something we would all want. Now, in our clinic, what we do is basically an advanced form of PRP along with the growth factor concentrates to help in the healing, boost up the growth, and eventually give you better results. PRP is used along with the FUE technique for better results. As I mentioned, in our clinic, we're using an advanced form of PRP along with growth factors with the FUE method, which eventually boosts up the growth and gives great results. How to choose the best technique for you. Now, FUE, thanks to new hair transplant technology, there are advancements in even the FUE procedure. It is no longer just FUE, we can do Nano FUE as well. In Nano FUE, in our clinic, we customize our punches so they are nanometers rather than millimeters. And this gives less scarring, better healing, less downtime, and overall better results. So according to me, the Nano FUE procedure is much more effective and surgically safe. Now, a lot of times you may wonder about FUT, why not FUT? So FUT, as I mentioned previously, is more invasive. There is more of an incision involved, there's sutures involved, more pain involved, more downtime involved. With FUE, you can even be back to work in 3 days. But I may consider an FUT surgery in case someone does not have any kind of donor area, very bare minimum donor area, in which case we may have to consider a strip surgery where we would take the strip from the back and dissect the grafts and use those grafts. Ultimately, it is up to your doctor to decide which surgery will suit you, whether it's FUT or FUE. So the grade of baldness is very imperative in this case, as this is also what dictates which type of surgery we will choose. And now we come to the cost, everyone's favorite question. So the cost is very dependent on many factors, and you can expect it to range anywhere from 30,000 to even 2 lakhs onwards, depending on the number of grafts, the quality of your donor, the type of procedure used, the technique used, and so many other factors are taken into consideration. So now you know which technique will be the best for you, FUE versus FUT. I hope you found this information helpful and I've answered all of your questions. If not, you can comment down below and I'll get back to all of your questions. For now, you can like, subscribe, and share this video.